Good morning. I understand that you had a root canal about 3 years ago and it got reinfected and they were going to try and do it again, and you sort of got really fed up with it and you said, just take it out. Okay. Well, have you decided whether you want a bridge or an implant? Do you know what an implant is? You do. All right. Do you know how it works? All right. So right now, what you've got in your mouth is something like this, right? You got a back tooth, and you've got a space, and you've got a front tooth, right? That's what you've got right now on that left side, all right? That's what we looked at just before, just a minute or two ago. So let me just explain a couple things. If you decided to have a bridge, all right, what would happen is that your teeth would be trimmed down. Now, that's okay if you have a huge filling here and you have a huge filling here, because that actually will strengthen the whole situation, and it's better for the teeth. But this tooth here has no filling in it, so it's a virgin tooth, and this tooth is a virgin tooth as well. So if you do a bridge, which looks like this, okay, see how that fills in? It covers one tooth with the crown, and this tooth it gets covered, and then this tooth fills in the gap. Well, that's okay, but you have to cut away the teeth like that in order to get the bridge like that. All right? Now, cleaning is a little bit more difficult as well, because you have to fish your floss underneath this tooth here. We call it a pontic. Most people call it a fake tooth. But it's fused, as you can see, it's fused to these teeth on either side. So this is a permanent bridge. Once it's in, it's going to stay in, all right? So it's a good thing, and conventionally, before we had implants, it was a great idea, because people could then have, the teeth wouldn't move because there was one gone. The tooth on top wouldn't drift down into place because the tooth was gone. It was a great way of restoring your teeth. But now we have ways that are more conservative and that clean better as well. So now what happens, when you've got a space, we actually make a small hole. And then we put the implant into the hole, and we actually screw it into place, just like that. Just, okay? And then we take the crown, and these are the crowns that you already have in your mouth, and we put everything in place. And then you have 3 teeth. Now these teeth then become untouched teeth. These are your own teeth as they are, and this now is supported with a titanium root. It's down into the bone. It heals in place for about 3 months, and then we bring this crown to place, and we actually cement it in place like that, so that you have the good function. And look at this. You can clean it by flossing through there and flossing through there, just like you clean your natural teeth. The other thing is that this will never get decayed. Bacteria can't attack titanium, all right? And so that's a wonderful thing. I like to talk about implants with people, especially as they get into their 50s and their 60s and beyond, because it's at those times of their lives that changes do start to happen for some people. And when people have medications that dry their mouths out, they become more susceptible to bacterial infection through their plaque, okay? So when we talk about doing implants, we've got something that we know is going to stay there for the long term, and people aren't going to have to worry about that. Now, those are implants for your situation, okay? And do you have any questions about that? All right. Well, there are lots and lots of applications. So here's basically what you have, and we would put implants in here, okay? You can see that this person has had a number of implants, a couple on their upper left side, a couple on their upper right side, a tooth in the front. And these can be made to fit your mouth and make your mouth look as natural as if it was your own tooth root, okay? Sometimes people come and they don't have enough bone, and that's a big challenge. So for this person here, they've just got 8 teeth left in the front and 1 lone soldier in the back there. So placing implants, especially when a lot of the bone has resorbed away, is sometimes a case of actually widening the bone and putting the implants in on the same day. So there are techniques that allow us to do that. And it's a wonderful way to get teeth back in to an area where they haven't had anything for many, many, many years. That's the bottom. These are bottom teeth here, and that's one of the ways we solve that problem. In the top, sometimes they don't have enough bone, even though the teeth have been taken out. You'd think that there was space for the roots. There was space for the roots. Now there'll be space for the implants, and there aren't. And so sometimes we have to actually open up areas of the sinus. This is what most people don't understand, is that right in this area, right there under your eye, is where the sinus cavity, it's just a large cavity, just like that, okay? And sometimes we'll actually open the side of the sinus and put bone in there, let it grow for 6 or 8 months, and then we can go in and put the implants that are necessary. So they can get back teeth done, they can have a full complement of teeth if they should so desire. Implant dentistry has allowed us to do things to reconstruct people completely. We can give people front teeth, back teeth, everything that they need so that they can not only chew, but they can function as they would normally. They can laugh with freedom. They can, it's just great. Earlier this week I had a woman come in and say, you know, we did this work several years ago where I had to have some bone put in my sinuses, and I've got 5 or 6 implants. She says, I forget the number. And she said to me, this was quite interesting, she said, how do you tell people, how do you communicate to people how great it is? How great it is to have that tooth back or those teeth back, to be functioning on that side again where you haven't been able to function for so many years. And this is a woman that's in her 70s. These are not people that are just like young people that need to have all the vital and vigor and beauty. These are people that have gone sometimes many, many years handicapped by the fact that they just don't have the teeth there to function. And so it's a wonderful thing to do. And maybe this has been a little bit of overkill for you, but it tells you how vital implant dentistry is to the public now and what's available, what's accessible. Your situation is pretty straightforward. The actual time, you'll be sedated for this, so you don't have to hear me making the hole in the bone. That sounds kind of gruesome, doesn't it? But it's not. And here's another thing about implants that you should know is that bone does not have nerve endings in it, okay? So you don't feel pain of the screw that I showed you here that being in the bone. There's no discomfort and pain. You will have some tenderness because we'll be stitching the gum back in place. We have to part the gum, and then we put the implant in place, and then we stitch that up with 2 or 3 stitches. But you know, most people say when they've had something like this, it wasn't really that bad at all, sort of like having a tooth taken out. So I think that you'll find that it'll go very easily. We've had lots of experience doing it for lots of folks, and what you'll get is power to chew. All of a sudden you'll say, how was I chewing on that side? Well, actually I wasn't chewing on that side, I was chewing on the other side. Right? Thanks.